This is RTV6 News at 7, working for you.
And now at 7, a live look at Indianapolis Motor Speedway from our Weather Now network camera. Racing is back at IMS this weekend, but fans will not be in the crowd, which means they'll have a chance to stay inside and beat the heat this holiday weekend. Let's get right to Storm Team 6 meteorologist Kyle Mounts with your Independence Day forecast. A hot one, Kyle.
Yeah, Amanda, beating the heat is going to be the name of the game this weekend. We got back into the 90s this afternoon, so we got 5 of them now, 5 90-degree days so far this year, and this is going to be a rapidly growing list as we go through the next several days. As we look across central Indiana, we still have a few spots that are in the 90s, 90 degrees in Muncie, Lafayette, and Bedford, and Sullivan coming in at 92, while it's 88 in downtown Indianapolis. High pressure, that's scooting over central Indiana, and that's keeping the organized rain off to the south and west, and keeps our rain chances pretty low going through the weekend here. Saturday and Sunday, just about a 20% chance of seeing a passing shower out there. This evening, no threat of rain in the forecast. We'll keep it partly cloudy with those temperatures still 80 degrees at 11 o'clock, and our sun will set here in a couple of hours at 9:17. We'll take a closer look at your July 4th forecast in just a few minutes.
And we are keeping track of the spread of coronavirus in Indiana as more states deal with spikes in cases. Today, the State Department of Health reported an additional 19 coronavirus deaths, 11 of those previously unreported from Allen County, dating back to April 19th. According to the Regent Street Institute, which is tracking trends in the state's data, coronavirus cases and ICU admissions are increasing in Indiana while deaths are decreasing. And with cases on the rise in 35 states, officials are urging people to be vigilant this holiday weekend to contain the virus. Yesterday, the U.S. set a record for new coronavirus cases, more than 50,000. In Arizona, intensive care units are 89% full with less than 200 beds left. Hospitals there and in San Antonio, Texas, are using pediatric ICUs for adults as they run out of beds. According to the State Department of Health, 41% of ICU beds are available in Indiana right now. And later this summer, state health officials will make public information about the specific location of Indiana nursing home deaths linked to COVID-19. It's data that families, advocates, lawmakers, and Call 6 Investigates Kara Kenny have been asking about for months. Kara explains what this information will highlight, what some say needs to happen next.
We've been asking since mid-April where people have died in Indiana nursing homes and where they've gotten sick. The state has denied us every single time, citing privacy concerns and even telling us they don't have the information in a document. Well, now the Holcomb administration has changed its stance.
We are going to report facility-specific COVID-19 data.
This apparent change of heart is encouraging to people like David Johnson.
Well, I'm really happy the state's decided to reverse course.
His loved one died at an Indiana nursing home in April, and even though the facility chose to publish COVID-19 information on its website, David says it's data everyone should get to see.
It's transparency that not only the families appreciate, but the communities where these nursing centers exist, I think really do deserve that kind of data. Why the state took 4 months to now come to this, what seems like a reasonable decision is a little bit strange.
The state says earlier in the pandemic, they were focused on testing and infection control at nursing homes and credited groups like AARP for making the change.
We were just as surprised as everyone, but it was definitely welcomed information, information that we've been waiting for and have deserved for a long time.
The new dashboard will be released later this summer and will contain data for nursing home residents and employees, demographics of those who had COVID, and the number of recoveries. Advocates and lawmakers hope the data will show exactly when deaths and cases happened.
We can maybe learn from those facilities that have had a significant impact and what they're doing better now and what has helped. And so I hope that we can use this data to tell the story and learn from it.
I need to understand whether this is something that happened 90 days ago, it's been totally cleaned up, or whether it's ongoing. Yeah, the data has to be put together in a way that does not mislead or panic people, but does inform them.
The state says it plans to publish data that goes all the way back to March 1st when the pandemic began. Families and advocates say they'll be keeping close watch once it's posted. We requested a one-on-one interview with Governor Holcomb. We were told he's unavailable and that we can ask questions at the next news conference on Wednesday. Reporting at the State House, Kara Kenny, RTV6.
And we also reached out to the Indiana Healthcare Association, which represents nursing homes. They told us, quote, "We sincerely appreciate Governor Eric Holcomb's leadership and his administration's consistent efforts to engage our professionals throughout this pandemic and look forward to our continued collaboration," end quote. An Indianapolis mother is reaching out to RTV6 for answers after she says she was not able to get through right away when she called 911 after her son had been shot. RTV6's Megan Sanctorum asked county leaders what happened and leaders how to make sure your call is answered and learned how to make sure your call is answered when seconds count.
You have reached 911 emergency dispatch. Do not hang up.
In a life-threatening situation, it's not what this mom wanted to hear. A recording telling her to stay on the line moments after her 19-year-old son was shot. According to call logs, she waited on hold for 1 minute and 38 seconds before hanging up and calling 911 again. That time, she hung up after waiting for 16 seconds. A dispatcher called her back right after that.
It's very disheartening that 1 o'clock, 2 o'clock in the afternoon on a Sunday that I can't get the police, we'll get 911 on the phone. Like, what's going on that we can't get anyone?
So we took her questions to leaders at the Marion County Dispatch Center. They tell us in this case, there were several factors that led to the delay. When she called about her son, 911 calls were also coming in for a hit and run accident, a reckless driver, and an unconscious person. They tell us her wait time was well above Marion County's average, which is currently 11.4 seconds. Another contributing factor is abuse of the 911 system. Leaders say about 60% of the calls that come in are not true emergencies.
That's very frustrating because there are emergencies come through, like this lady and her son. They had that was a life or death emergency, and her call should have been answered a lot sooner, and it wasn't.
They also battle low pay for dispatchers, which leads to turnover and a 911 center that the county has outgrown. They're things this mom hopes are addressed sooner than later.
Luckily, my son is okay, but what if he wasn't? And I don't want to think about that, but at the same time, what could have happened and how many other people this is happening to.
Working for you, Megan Sanctorum, RTV6.
Leaders with the dispatch center want to remind you to not hang up if you call 911 and get a recording. They say calls are answered and returned in the order they are received, so calling back just ties up the system. And after that mother contacted us, we wanted to know how often other people experience similar delays. Call 6 Investigate's Stephanie Wade has been comparing 911 wait times for the past 2 years to find out why some people have to wait longer.
911, what's the location of your emergency?
When you need help, seconds matter. And when people call 911, they expect to speak to a dispatcher quickly.
And your phone number, sir.
But in Tiffany Coker's case, she waited for 1 minute and 38 seconds before hanging up, then calling back a second time and waiting for 16 more seconds before waiting and hanging up again. A dispatcher eventually called her back. Call 6 Investigates requested the call log records from last year and this year, month by month, to see just how big of a problem this is, if at all. We found in 2019, the average wait time for someone to speak to a dispatcher was about 19 seconds. The Marion County Sheriff's Office tells Call 6 Investigates each year, June and July are always the 2 busiest months for the 911 center.
911, the case of your emergency.
During that time frame, Coker called on June 14th. There were multiple active incidents throughout Marion County that might have caused the long wait time, including a hit-and-run accident with injuries, a reckless driver, a disturbance, an unconscious person, and more. The sheriff's office says they believe the 911 center has seen so much turnover because dispatchers in Marion County are paid significantly lower than surrounding counties. But they want to remind people, do not hang up. They answer calls in the order they occur. I'm Call 6 Investigates, Stephanie Wade.
If you ever need help or want to expose a problem, email us at workingforyou@rtv6.com. Still ahead on the news at 7, researchers think they might have an explanation for the different ways the coronavirus impacts people, what they are learning about different versions of the virus. But first, a woman explains why the push to mask up is so personal for her and other organ transplant recipients.
This is RTV6 News at 7, working for you.
I know that what my doctors tell me from IU is what I have to do. They're the experts. I wish more people would just listen to the doctors.
It's a plea for you to mask up. One transplant patient says wearing a mask can mean the difference between life or death for someone like her. That plea comes as Marion County prepares to mandate masks starting July 9th. Nikki Foster is a double lung transplant recipient. RTV6's Cornelia Hawker is sharing her story and explains what her doctor is doing to try to protect patients like her and the simple way you can help too.
If you were put into somebody's shoes that is my shoes, immune compromised, you would want people just to be nice, just for the courtesy of humanity, just to put a mask on.
Nikki Foster feels that way because for almost 5 years, staying healthy has been her top priority so she can be around for her family.
My youngest is 11. I was actually asked to help coach cheer for her this year, which is huge because I used to coach my middle daughter through cheer. And then I had to stop when I got sick.
For Nikki, the debate over wearing a mask feels a little trivial because she had interstitial pneumonia, which damaged her lungs over the course of almost 4.5 years.
16% lung capacity. So I kind of know what it's like to not be able to breathe. People can just pull their mask down for a quick second, get a breath, and pull it back up.
To get the message across about social distancing and wearing a mask during the pandemic, doctors at IU Health made these shirts for their transplant patients, which say, "Please stay back or wear a mask. Transplant patient hard at work."
I saw the shirt and I was like, I have to have that. I have to have that. That's amazing. I'll see people read it and then they'll kind of back up if they're not wearing a mask. Or I've also had people come up to me and say, "Oh, you're a transplant recipient, so am I."
Nikki tells me she hopes this shirt and her message get people thinking about how they can potentially save lives if they choose to wear a mask.
This is temporary for most people. Most people, they'll get back to life and they'll get back to living without their mask once, this gets under control. But I'll never get back to not wearing a mask when I'm out. I'll always have it on.
Working for you, Cornelia Hawker, RTV6.
The heat is on. We were back in the 90s this afternoon. I'll let you know when that thermometer could hit 95. You're watching RTV6 News at 7.
Ash Jefferson Awards.
Researchers say they've identified 3 variants of the coronavirus in Chicago, which may help explain why some COVID-19 patients have higher amounts of the virus in their airways. Mandy Gaither explains in today's Health Minute.
The coronavirus doesn't behave the same way in all patients. That may be because there are different variations of the virus across the U.S., according to a study from researchers at Northwestern Medicine, which has not yet been peer-reviewed. 3 distinct variants have been identified in Chicago and are associated with different patterns of spread. One is most closely related to variants centered in New York, which showed evidence of rapid spread across the U.S. Patients with this variant were found to have significantly higher viral loads than those infected by the second variant, which researchers say is localized primarily in the Chicago area and appears to be directly related to the early outbreak in China. The third variant has been found to be most closely related to versions of the virus going around the state of Washington. One of the lead researchers says it's possible that if one virus variant has higher viral loads in the airway than another, it may be transmitted more easily. It says they're still researching that possibility. The researchers say their work may help with vaccine development. For today's Health Minute, I'm Mandy Gaither.
And the team has continued to study the variants from Northwestern Medicine patients to observe how the numbers and characteristics of the different virus variants are changing over time. Kyle.
It is after 7 o'clock, and we still have some communities in the 90s. It is 90 degrees right now in Kokomo and Muncie. Close to it, Greenwood, Bloomington, and Indianapolis all coming in with a pair of 8s on the thermometer. And the overnights aren't going to be all that cool either. We'll still be around 70 degrees in the Greenwood area. Most locations mid to upper 60s as we start off the holiday weekend here on Saturday. 67 degrees in Noblesville and Kokomo, 68 tomorrow morning in Bloomington. As we look at your Saturday and 4th of July forecast, it is going to be another hot one, and those temperatures warm quickly. Already 83 degrees by mid-morning, and we'll see that afternoon temperature get around 90 by 2 o'clock there, and that's when we'll also have chance for an isolated shower or thunderstorm. Not everyone's going to see the rain here, but as we look at TrueCast, 1:30 tomorrow afternoon, you notice we've got some clouds, and that's where we start to pop up a couple of those isolated downpours. Severe weather isn't expected, but these storms that do develop aren't really going to be moving a whole lot either. So you may get a quick downpour, and then they'll kind of rain themselves out, fade away. And I think they all start to fade away here as we go into the evening. But it may bring only temporary relief from the heat. 93 tomorrow afternoon in Rockville. You may be looking for the pool or an area of water to cool off a little bit. 91 in Rushville. A little more humidity in the air tomorrow, so it'll feel just a little bit warmer than that actual high. But I think it's a good go for the fireworks forecast. Tomorrow evening will be dry by 7 o'clock, and we'll just have a few clouds. Those will continue to thin out here with temperatures that will still be 87 degrees at 7 o'clock tomorrow evening, 80 degrees at 11 o'clock tomorrow night, and that sets us up for another warm one on Sunday. I think we may even see a little more sunshine, so we might be able to pull back that rain chance altogether, but that means temperatures will be just a little bit warmer. We'll still see those numbers getting back into the lower and middle 90s, and the heat is going to be with us throughout the month of July. As we get into the new month here, the outlook for the month calls for above average temperatures. There's our average high, which is in the middle 80s, actually starts to slide back the other direction as we get to 84 by the end of the month. 7-day planning forecast now, just light rain chances here as we go through the next couple of days. There's that 95-degree high on Monday with partly sunny skies. A little better chance for some rain coming in on Tuesday and Wednesday afternoon, but again, it's only about 30%. So a lot of us are going to go through the next 7 days dealing with 90-degree heat and not a drop of rain. Another chance for some showers by Friday.
New guidelines from the federal government are encouraging airlines to leave some seats on planes open and have all passengers wear masks. But the guidelines stop short of making these measures mandatory. Consumer groups and airline employee unions say mandatory public health standards are necessary to keep everyone safe. Airlines are requiring masks, but enforcement of the rule varies, and not every airline is leaving seats open. The UK is expected to designate the U.S. as a, quote, red list travel destination due to concerns about the rate of coronavirus infection. The British government created a list of more than 50 destinations considered to be safe for its citizens. Those countries were divided into green and amber groups, with green representing the lowest occurrences of the coronavirus. The news at 7. We'll be right back.
Sandwiches. Get rallies delivered.
The pandemic has canceled sporting events across the country and around the world, but it won't stop a 4th of July tradition in New York. The Nathan's Hot Dog Eating Contest will take place tomorrow, but it will look different. The competition has been moved indoors to a secret location. A much smaller group of competitors will be seated 6 feet apart. Contestants and staff will be tested for COVID before the competition, and everyone will wear masks and gloves when they can. 12-time champion Joey Chestnut is back, and he says he will try to break his world record of 74 hot dogs in 10 minutes. A study shows Netflix pricing power is increasing as the pandemic continues, even with competition from other streaming services. Back in December, a study from Cohen & Company found 47% of users would pay more to keep Netflix. A more recent survey found 55% would cough up more money, but analysts say Netflix is not likely to increase prices this year. The last time they did that was early 2019.
Feeling hot, hot, hot over the next 7 days. And in fact, those rain chances going to be very low. So most of us will get through the holiday weekend here without a drop of rain. Could see an isolated shower tomorrow afternoon and evening, though. I think that dries out in time for fireworks. And as we go into early next week, the hottest of them all comes up on Monday at 95 and a better chance for rain by midweek.
Thank you for making RTV6 your choice for news. Our next newscast is tonight at 11. Have a great holiday weekend.